I'm Chris Elias. I'm the President of Global Development at the Bill and Melinda Gates Foundation, based at our headquarters in Seattle, Washington. So the Gates Foundation has quite a few areas of focus in health. The way to understand how we select our health priorities is that we really begin by looking at what are the major causes of morbidity and mortality, particularly for women and children. And so we look at the number of children, for instance, who are dying before their 5th birthday. Just 20 years ago, there were 11 million children every year who died before their 5th birthday. Today, it's about half that number. But even if we look at that half, we see that there's still an unfinished business related to vaccine-preventable disease. So our priorities follow the burden of disease. So we focus on vaccine-preventable diseases, the eradication of polio, the broad range of issues related to reproductive, maternal, newborn, child health and nutrition. We are increasingly involved in work on strengthening primary health care, because primary health care is the most cost-effective way to deliver a broad range of services for mothers and children's health. And so those are our key priorities, tend to be the key things that are causing death among women and children: pneumonia, diarrhea, malaria, and among adults, tuberculosis and HIV. So that's how we choose our health priorities. And we work on, I would say, the most common causes of significant and preventable disease among both adults and children, and with a geographic focus in South Asia and in Sub-Saharan Africa. So in India, India is our largest and oldest country office. We've been working here in India for over 15 years. And what we do in India is what we do in most countries. We try to understand what the priorities are of the government of India, to understand how to inform those priorities with good evidence from research. If we don't understand, for instance, the causes of diarrheal disease, we'll often do projects of surveillance to understand what are the common causes of those illnesses. And then we work with the government to try to strengthen the technical support for their priorities. So, for instance, in immunization, the government of India has a very bold agenda to increase the coverage of routine immunization, while at the same time introducing new vaccines. And so we've been happy to partner with the government of India, both at the federal level and at state level, to help advance that agenda. So we work on a range of issues here in the India program, both nationally and in particular with some very intense work in the states of Uttar Pradesh and Bihar. So the immunization is one of our highest priorities, and it's the highest priority of most governments because it's vaccine-preventable disease is very common, and addressing it with immunization is one of the most cost-effective interventions in public health. We estimate that if you look at just direct benefits, that for every dollar that's invested in immunization programs, there's about a $16 return in terms of lives saved. If you actually take into account the broader set of impacts of disease in terms of time lost, et cetera, there's about a $44 return for every dollar invested in immunization. So the simple answer to why we spend so much time focused on immunization is that it's one of the best buys. It's really one of the best opportunities to save lives at very low cost, particularly in areas where vaccine-preventable diseases like measles, rotavirus, pneumococcal disease, pneumonia are very common. And India still has quite a large number of children who are affected by vaccine-preventable diseases. So the bold agenda that the government of India has through the Mission Indradhanush is a very important way to advance India's goals of reducing maternal and newborn and child mortality. I think that what we try to do is to align our technical support and our philanthropic support with the priorities of the government. And so we've been proud to participate in the bold agenda of the government of India in improving immunization coverage. We're also partnering with quite a few Indian companies to produce affordable, high-quality vaccines, not just for India, but for the rest of the world. If you look at the vaccines that the GAVI Alliance purchases for for sub-Saharan Africa, about 70% of those vaccines are actually manufactured here in India. And I think so, while there's some criticisms of some of our work, I think there's also a lack of appreciation for the breadth of our work in terms of helping to harness the science and technological expertise here in India, not just to serve India better with more affordable vaccines, but to actually bring those high-quality, affordable vaccines to the rest of the world. You know, it's interesting. We work on immunization programs in many, many countries. And what we have found is that rarely is that an either-or choice. In fact, we found the opposite, that introducing new vaccines and improving immunization coverage are synergistic activities. That when you introduce new vaccines, particularly some of the powerful new vaccines that prevent some of the most common causes of child mortality, in particular pneumonia and diarrheal disease, parents and communities begin to see the benefits of vaccination even greater than they did before. Some of the older vaccines have been in use for so long, and the coverage is adequate enough that people forget that the diseases that they prevent were once very prevalent. But when you introduce a new vaccine, and parents see that the rates of diarrheal disease, the rates of pneumonia drop dramatically for their children and their family, but for also their community, it actually helps to create a greater acceptance of vaccines, which helps to it helps to improve the immunization coverage. So I think it's not an either-or question. I think actually if we do both, we can actually find a synergy in improving immunization coverage while we're at the same time introducing new vaccines. So the GAVI Alliance we were involved right from the very beginning. We often say that our support for GAVI is our oldest, largest, and best grant that we've ever made. So we have given more funding to the GAVI Alliance than we have to any other single recipient of our philanthropic support. And over the last 20 years, GAVI has saved the lives of millions of children and prevented hundreds of millions of cases of vaccine-preventable disease. So we think it's one of the best bets, best investments we've ever made. And it's important because GAVI works in all of the low and lower middle income countries, about 72 countries around the world. The Gates Foundation has some direct collaborations, as it does here in India, and about 4 or 5 countries in Africa as well. But we can't possibly work directly in 70-some countries. So a lot of our support to GAVI is a way of making those vaccines available, high-quality, affordable vaccines available to the whole range of lower and lower middle income countries. So the Gates Foundation works on a broad set of activities here in India. And again, we align with the priorities of the government of India. So on immunization, we work closely with the Ministry of Health and Family Welfare on the mission Indradhanush. We work closely with in the sanitation sector with the Swachh Bharat program. Our work on financial inclusion has been very much involved with the really highly successful efforts of the government of India to expand digital financial services. So in each area, we have seen significant progress. If you look just in the area of immunization, if you look historically, the rate of immunization coverage was going up by 1 or 2% a year. And under mission Indradhanush, it's gone up 6 or 7% a year. So we've seen more rapid progress by aligning our programs and efforts with the priorities of the government of India. And we've seen progress across a broad range of sectors, including health, agriculture, financial services, sanitation, as well as some other areas.